President William Ruto has pledged to fast-track reforms at the National Health Insurance Fund, NHIF. Ruto says the contribution model to NHIF will soon shift from the individual contribution scheme to a household contributory model. Ruto, who spoke during his first Mashujaa Day Celebrations as head of state, made the announcement as part of reforms that he seeks to introduce in the health sector to make health services accessible and affordable to all Kenyans. Serfine Achieng with details on the president's promise for the health sector.
In his maiden Mashujaa Day as president, William Ruto's one-hour speech was pegged on how he seeks to change the fortunes of the country during his tenure as president. Key among the promises he made include reforms in the health sector, the president announcing plans to restructure the National Health Insurance Fund, which he says is inaccessible to self-employed Kenyans who form the majority.
In the last 10 years, 12 million Kenyans have joined the fund. The challenge, however, is that the NHIF is an occupational scheme that is tailored for salaried people on payroll in public and private sector, and not the social insurance scheme it ought to be. We shall change the contribution structure from an individual contributory scheme to a household contributory model.
Under the current model, employees earning over 100,000 shillings pay a fixed monthly contribution of 1,700 shillings to NHIF. This means that if in one household the income is 100,000 monthly, they pay 20,400 shillings to NHIF annually. And if a couple in another household earns 100,000 each a month, they will each pay 20,400 shillings a year to NHIF, amounting to 40,800 shillings annually for that household. Yet the two families access the same health services. This, according to President Ruto's administration, is highly inequitable. The Kenya Kwanza manifesto suggests that if the 150 million out-of-pocket payments were converted into contributions to NHIF, each Kenyan would have to contribute only 3,000 shillings a year, or 12,000 shillings for each of the 12 million households.
Kenyan families spend a total of 150 billion in out-of-pocket expenditure on health services a year, mobilized from various sources including Harambes, WhatsApp and M-Pesa groups, loans, sale of land and other assets to pay hospital bills for loved ones. 1 million Kenyans sink into poverty every year because of medical expenses.
President Ruto also said that the government seeks to further cut the cost of healthcare by investing heavily on preventive care as opposed to curative care.
The plan is to revitalize primary healthcare by laying more emphasis on preventive and promotive strategies. Many critical health illnesses, including cancer, heart complications, kidney failure and hypertension, can be detected and addressed at this level without the need for hospital visit or admission.
President Ruto echoing his campaign manifesto, which promised the employment of 20,000 healthcare workers, establishment of a commission for the management of human resources for health, as well as harmonize the terms of employment for healthcare workers in the spirit of equal work. Serfine Achieng, Citizen TV.